So again, I think this comes back to the core problem. Like, the waiting list for therapy was getting longer and longer. In fact, still is getting longer. We have a solution that can help reduce those waiting lists as the core first concept principle of what we're trying to do. They're desperate for that. And guess what? We've got therapists of a similar standard, similar quality, with a similar, we're able to get these therapists from other areas, from even the private side, and bring them back in to help the NHS. So, that way we're able to help solve that huge problem. And therefore they were jumping at the heels to try and get our capacity, basically.
The opportunity to innovate in healthcare and to solve some of the world's most pressing issues is vast. And as a doctor, you have a unique position and insight into solving some of those pressing issues. But hey, it's really daunting, especially when you don't know where to start. So in today's episode, I catch up with Dr. Julian Nesbitt, a dear friend of mine, who is also an entrepreneur and founded the Dr. Julian Medical Group after identifying a significant mental health crisis in the NHS, and was driven to solve that problem. In this episode, we focus on his journey, but also really identify what are the key factors that have led to his success as a doctor, and how he used his unique insights and positioning to really grow his company in a competitive market and also selling to the NHS. Before we get started, don't forget to subscribe to your current platform of choice if you're really enjoying these podcast episodes, and also our mailing list at medicfootprints.org/join our mission. So on to the episode. Let's face it, burnout amongst doctors is sky high, and we're actively seeking other ways to make the most of our transferable skills beyond the usual career pathways. Welcome to Disrupting Doctors' Careers. I'm your host, Dr. Abena Bubbs-Jones, and I'm on a mission to connect 1 million doctors across the world with the best in diverse career opportunities. Hello everyone, I'm here with Dr. Julian Nesbitt, a dear entrepreneurial doctor friend of mine, who I think we've traced our relationship, our working relationship, back to the NHS Clinical Entrepreneur Scheme, which was started, was it 2015, right? That was, or 14, what was the first year?
Yeah,
I think it was a while ago.
I think it was 15 or 7 years or so now, wasn't it? So yeah.
Yeah. So, we've both started and grown really impactful businesses, and reconnected very recently at the Giant Healthcare Conference that was in London a few months back, and really found this a really great opportunity to reflect on our experiences as doctors that have founded companies, but particularly really wanted to focus on the value of a doctor for health tech companies. So if you are a doctor with an idea for health tech, the really important part of being a doctor founding a health tech company is recognizing what upper hand you have and what important and unique insights you have compared to someone who is not a doctor, who has not worked in the healthcare system, because there are plenty of non-doctor healthcare founded companies out there. And remember, one of the benefits of working in an innovative company is also making sure that you remain ahead of the competition. So without further ado, we're going to have a really cool conversation about that. And we're going to start with learning a little bit more about Julian and why he founded the Dr. Julian Group. Is that right?
Yeah, apologies for the name. It wasn't actually my idea for the name, but it's called Dr. Julian Medical Group Limited, but it's kind of stuck now. So that's who we are.
Nice. It says who you are. It does what it says on the tin. There you go. You're growing an empire, clearly. But tell us about your first platform. Why was it important for you to found a platform? Tell us a little bit more about it.
Yeah, so firstly, thanks for having me. It's really great to see you again and reconnect. So my original inspiration, so I was an A&E doctor. I'm now actually a GP, I'm doing 1 day a week. I think, we all know the massive challenge of mental health that this country and the world is facing, and this huge supply and demand problem. My original inspiration, I think I saw 9 patients in a row who try to kill themselves as an A&E SHO/reg, and I was like, what is going on here? Just the sort of the fact it was in a row, and then asking them why, and it was all because they're on a 9-month waiting list to get actual proper therapy support, and this was sort of 7 years ago now. So I was a bit like, this is crazy. Why are we? Is there a way to improve this? Could we make this better? And I thought, why are we not using digital technology to enhance this process and reduce the friction between connecting you to the right therapist or the right clinician for you? And then it's kind of evolved from that concept into something much bigger. But yeah, I think for me, it was having that clear mission and value of how can we improve access to mental health services, basically. So that's where it stemmed from.
And why you? Why did you think this was a problem for you to solve? I mean, do you know what I mean?
Yeah, that's an interesting question. I think sometimes things just affect you, don't they, in certain ways? And I think that shift I had just really deeply affected me. And I thought to myself, this is a problem. And I guess I'm someone that likes to solve problems. And I think my father was an entrepreneur, right? I became a doctor. So I don't know whether I've got some entrepreneurial spirit inside me that was like, let's try and do something to help that. So yeah, I think that was the key to it.
Great. Yeah, I mean, because as doctors, we see problems all the time in the course of our work, right? And yeah, we love solving problems. Like, that is one of our raison d'etres for doing the work that we do and being really good at it. And so it's really interesting that obviously, it's built on like several tragedies, in a run, and really touched some heartstrings for you at that time. But I'd love to hear a little bit more about the next step. So you recognize there was a problem, you want to try and solve it. How did you actually go about doing that in a nutshell?
Yeah, and
actually like identifying like what is the best solution for it, because that is also quite a difficult thing to do.
Okay, and I think we can come on to this, like, in terms of what kind of character you are. I'm an ideas guy, right? So I come up with all these ideas and you need to try and then execute. So so I think for me, it was at the time, Uber was out there getting better. All of these companies are out there being able to connect you immediately on your phone. So I thought to myself, why don't create a telehealth platform just to connect some more easily? And surely if we do that, we can help match supply and demand better, increase capacity across a wider network, even an international network of therapists. And could you actually help match people to the right person for them? So that was the idea behind it. So I thought to myself, okay, well, how do you go about doing that? Well, the start, right, is always terrible. So I built this very dodgy app that with some very dodgy Russian developers. And I would say the first thing you do, right, is you don't go and build an app straight away. You need to sort of test something, understand what the market needs. That's the key, right? Understanding the market need of what you're doing and how that's going to work. And don't go and build something without understanding that first. Because then you've just wasted a load of money, and try and do things in a more simplistic way, like even a web page or something like that that's easier to do. So anyway, I built this dodgy Russian app, and it was originally for the private market, because I was like, okay, well, let's just see if I can get some therapists and put it on the private market. And I connected with a therapist who'd helped me from that side of it to sort of get out there and recruit some people. And again, your team over time evolves and changes as things go on, but everyone is valuable at that time and place. So really, we did a great job when we started out, and then it just depends on how your team evolves. But so anyway, this dodgy Russian app, guess what? Nobody used it, because how the hell do you market something like this to the private market? You can't. You need loads of money. The cost of acquisition. How
did you actually market it in the end? I mean, like, you've built this Russian app. What did you call it? My dodgy Russian app? Like, called it My Dodgy Russian App.
No, it was called Dr. Julian, actually, from the start.
Yeah, why did you? I'm really curious. Why did you decide to call it after yourself?
I don't know how this came about. A friend of mine who I'd started the business with, who was going to do this company with me, came up with a name, and it was also a trademark thing as well. So I mean, there were doctor here's, doctor there's, doctor everywhere's, and I was thinking this could be more than just mental health. It could be other doctor type things in the future as well. So if you call it that, then there's no liability, there's no legal issues, and then we're thinking whether it's a more personal touch. So we're trying to, again, this comes back to the doctor-led thing. The fact is that we're trying to be more personal here. The idea for this company was not to make money. Actually, it's, can we solve a problem and help people? So from a more personal perspective, that's why that came up. And to be honest, at the start, like, thinking of another name is quite, it just fitted at the time. Whether it's the right name forever, who knows? But it seems to have stuck for the moment, so it seems to be doing okay. But yeah, sorry.
So, I was going to say, I was just going to touch upon something that you said within that. I think it's really interesting about how you've really it's like you've kind of taken on your mission and really, really owned it. So it's always going to be with you, regardless of whether you leave the company, unless they decide to do a rebrand. Right. Yeah, exactly. But I think that's a real personal way of saying, right, I'm taking responsibility and accountability for really solving this problem, and the solutions, the technology that we create through that. I think, yeah, it's challenging, but I think it's also legacy building. But I really wanted to go back to the point where you mentioned that when you first built this, you weren't doing it for money, like you weren't designing it for money. So I'd love to hear a little bit more about that, because as we know, there's different ways to form a company, right? Yeah. And if you're not doing it for money, then that would say, well, why don't you start it as a charity or equivalent? Yeah. So tell me a little bit more about that. I'd love to hear that.
Yeah, interesting point. Absolutely. I think for me to try and build something fast, or not, in fact, depending on how fast it was, I think at the time I took some advice on this, and they'd recommended that I did it as a company. So I was like, okay, we'll find a company. But from my values, I guess, wasn't about making money, but to be able to raise investment, to be able to have decent amount of investment to move forward to do what I wanted to do with it, it made sense to found it as a company. But I think, again, if the values you have is to make money, then the motivation is slightly different. Whereas my motivation was more, how can we build something that will help people? And I think that's what sticks with you, and that is the thing that keeps driving you with all the failures that you will go through in founding a company.
No, I think that's a really important point that you've raised, and I say to a lot of people, like, if we were in the business of making money, we would be in finance, we would be in investment, we would be all in like hedge funds, right? Like that is a business of making money, using money to make money. But no, as doctors, as healthcare professionals, we are really in a very altruistic sector. And Absolutely. Especially a lot of doctors, when they go on to found companies, they tend to be linked to healthcare or healthcare related, and really motivated by helping people and their well-being. So I think that that's what keeps you going through running a company, is because running a company, building a product, is extremely, extremely hard work. It's uphill struggle. It's a marathon. And the only thing that really keeps you going is the why, and why is it so important, and just recognizing that you are solving such an important and a hugely important problem at scale that's affecting thousands, tens of thousands, millions of people, maybe locally, but also across the world. So I think it's a really amazing mission that you've really decided to tackle, and that you're still tackling. Like, how long have you been doing this now?
Yeah, I mean, from concept, like 6-7 years, right? When I had that shift in A&E. But I think for the first 3 years, I was faffing, and it's impossible, right? You have no idea what you're doing. So I bootstrapped it completely, and then it's just iterating. And I tell you, it's the fact of, I think, just to go back to sort of, you built this app for the private market, okay? And obviously you've got to make sure that it's secure, and the data is in a secure area. And it's always been built on AWS, which made life a lot easier from that perspective. But I guess it was then, okay, well, the app, the UK, the private market is difficult, and especially because of all of the fact that you have to do that marketing, which costs more money than you'll make from that customer. So that's a really stupid business model. So then you kind of, okay, so if that doesn't work, then thinking about what could work. And this is about pivoting, right? So every time something doesn't work, if you've got a core mission that's actually you think, this is a problem. Well, okay, well, you might not be able to address the problem in that way, but how else can we address the problem? And I think coming back to being a doctor founded company and working in the NHS, I thought, okay, well, let's talk to the NHS because they are the mainstay of people that provide therapy. So I was actually really lucky. I had a trust that an IAPT service who provide the IAPT is how they provide the therapy in this country. That they said, I'm going to take a punt. Let's give you a go. Let's see if you can help us with some of our capacity. And you've got the therapist now. So let's try that. And I guess at the start, I think I had to phone every individual customer personally, apologizing for the technology because it was so terrible. But please bear with me. And again, with the therapist, and again, if you can sort of get them to buy into what you're doing, then they're more forgiving. And then what that means is over time you can start to develop and make that technology better and better, and build a sort of what we've done now is a progressive web app. So it's an app that goes across all mediums, web app, iPhone app, and iOS app, and it's from just continually learning from what that person, the feedback from your therapist and from your customers. But you have to start somewhere, and that's how it started, really.
No, I really appreciate that journey in the sense that you realize that this is an experimentation phase, it's trial and error, and actually there's probably hundreds and thousands of solutions to the problem. The question is which solution do you pick, and how do you know it's working or not working? And it's an ongoing process, and probably still ongoing now as the problem kind of changes and shifts as time goes forward. But I want to take you back to some of those earlier days when you were having conversations with the IAPT investors, etc. When you started getting the yeses to whatever you were asking for, what do you think it was that led to the yes?
Yeah. Okay. So when you talk about trying to do business with the NHS, I actually think being a doctor was hugely helpful, right? And there's an interesting saying, and I say, we've never actually had a salesperson in the business because you can't sell to the NHS at all. If anyone tries to sell to the NHS, it just doesn't work. You have to have a conversation with that NHS organization and talk to them, find out what their problems are, and say, well, actually, they actually come to you when you have a problem that is so desperate that they're trying to deal with. They will come to you, and then what happens is that they then refer you on to other NHS trusts. So it's all word of mouth. If you try and sell coming into the NHS, it just doesn't work. That's my experience. So again, I think this comes back to the core problem. Like the waiting list for therapy was getting longer and longer. In fact, still is getting longer. We have a solution that can help reduce those waiting lists as the core first concept principle of what we're trying to do. They're desperate for that. And guess what? We've got therapists of a similar standard, similar quality with a similar, we're able to get these therapists from other areas, from even the private side, and bring them back in to help the NHS. So that way we're able to help solve that huge problem, and therefore they were jumping at the heels to try and get our capacity, basically.
And how do you position yourself and your company against your competitors?
Yeah, so as we've kind of grown and scaled, obviously there's been more telehealth providers coming in, and I think again the system has grown a lot now. So it's not just therapy that we provide. For me, it's about giving choice, empowerment to patients. And we've got really quite sophisticated system now, which can help match people to the most appropriate person for them. Also gives them access to the right self-help tools, resources that are most appropriate to them, and in a personalized way on their own dashboards. And this whole sort of ecosystem that's an electronic health record, but integrating this patient-facing side. I think competitors generally don't quite have that level of technology, and no one really offers choice. They sort of give you the next available therapist. But for me, it was, can we give you someone that most suits you? And by doing that, we've managed to improve the engagement rates because people are booking their own appointments with someone that most suits them at a time that's convenient to them. So that was the sort of core pinnacle of that. And I think the other differentiating, we've got different business models now because we're actually licensing our platform as well out to other service providers for the technology benefits of this, the efficiency gains of digitizing things, plus the patient benefits from it. People now want to use our tech, which is brilliant for their own service provision, and I think very limited. That's not really happening in the market at the moment either. But how you differentiate from your competitors for me, it's about understanding what competitors are doing, but fully understanding the market and where it's going. And I think, one of the things I found really interesting is all of these companies that are coming out building AI chatbots for this, they're really struggling and they're overextending, and that's because the market's not ready yet for a virtual therapist. Maybe in 10 years, but right now they're not. So for me, it's about understanding what the market needs now. So how can we augment the therapist using digital, not replace them? Maybe over time you could then go more into that replacement phase, but right now the market is not ready for that. And I think some of these competitors might struggle because they haven't really understood what's needed now. And maybe coming back to your point about being a doctor, by having this grounding of knowing what the patients are saying to you, and this sort of doctor instinct, you kind of can understand that market better than someone that's developed something from a tech perspective, I guess.
I think it's a really important point to summarize on. So basically, being a doctor has helped you to understand the clinical need, but also to understand the needs of the healthcare system that you're selling to, like what's important to them, and really matching into those. Well, I mentioned 2 prongs there, I'm sure there's others, but those are the key elements, because other companies may not have those insights, on the ground insights, and be able to leverage it in the same way. You mentioned a whole lot of techie stuff beforehand, which I'm sure is an important part of that. But if we look at the fundamentals, it seems like the principles, that is the important point that I'd really like to highlight and summarize from what you've said, because it can be scary, especially when you're up against companies that have way more money than you, right? That have a lot more money than you, and you're like, how am I gonna? But actually, it's actually knowing the customer, knowing the client, knowing what they need, and really getting beneath the surface. And we talked just beforehand about addressing their pain points.
Exactly. Yeah. No. Exactly.
And another point that we actually quite keen to discuss today is about scaling in the NHS. So what is scaling? I know it's like one of those words that's thrown about constantly, especially related to any tech company, and sounds really, really cool. But like, why don't you tell us what you know, what you interpret the word scaling as?
Interesting point. I get,
and in the NHS as well.
I mean, scaling is synonymous for me with growing. So how do you grow the company? Well, scaling in the NHS is how do you grow the company inside the NHS, encompassing more NHS trusts or services, doing more with individual NHS trusts. So how do you grow that company inside an ecosystem, I guess.
And how do you do that? Because I know originally you were you probably dabbled with both private and public sector companies as clients. So tell us more about why you're focusing more so on the NHS at this stage of your company growth.
Yeah, absolutely. And that kind of comes down to there's an analogy which is called B2C, which is where you're a company going directly to a consumer or to a patient or whatever, and then there's a B2B element that can then go, actually you're going through an intermediary, then that then goes to the customer. And actually sometimes it's much easier to do the B2B bit because these intermediaries are much bigger and they already have all the customers, so you just need to sell to one of those to then get all of those customers, as compared to that B2C model where you have to market it to every individual person. So we do B2C, but we haven't really done any marketing because we haven't needed to, and the B2B element is where we're focused. So the NHS, for instance, will commission us to provide a service in that area for a set number of patients per month. And how do we scale? It comes back to that point of understanding what they need. And if you try and sell them something, it doesn't work. So, but if you say we're offering this and they've got targets to hit, where actually they're going to be penalized because they haven't seen enough patients and their waiting list is huge and they are under so much pressure to get that down, they will grab you at the horn to get you to do that. So that's how they came to us, because we found a problem that was so great for them, and that they were going to get penalized for. They were desperate to use it, and it was reasonably simple to use at that point. So I find a lot of tech companies trying to sell into the NHS, it's so hard, right? So NHS is so busy, as we know. Again, we're for clinicians working in the NHS, we know how stressed and stretched and everything we all are. To get someone to just adopt a new technology, it is really, really difficult. So the way that we're now doing that side of it, but actually the way in is to find something that they're desperate for to start with, and then you can start to sell more to them as things go, and slowly introduce things, such as changing the way that they do their technology. So I mean, that's the key, right? Find something that they are so desperate for and they're so needed, then they will come to you.
So no, actually, that's a good point. And the question is, how did they know to come to you? That's a question probably lots of doctors will ask.
Yeah. Okay, I was lucky with this first break. Inclusion Thurrock, lovely chap, Paul Baggett there, gave me a break. He's a service manager of the Inclusion Thurrock IAP service. And they...
How did you know him?
How did I even meet him? I think, again, if you do things, I use LinkedIn a lot for networking, and it's just networking, right? So everyone should network as much as possible, basically, and you never know what will happen.
This is one of the key points we're really emphasizing on every single episode, every single thing I say. It's develop your network. If you're looking to move careers, change careers, invest in developing your network, because that is the way to really uncover opportunities. Not necessarily applying for jobs, because that's the minority of opportunities that are out there, extreme minority, in fact. And once that job is out there, you're already up against, statistically, you're not going to get that job because the competition is huge, right? But it is those networks and nurturing those networks that will get you those big breaks, or lucky in inverted commas breaks. It probably isn't that lucky, to be honest. It's just as a result of you being you being a doctor, you keeping your ear to the ground, and you being connected with the right person who had the opportunity, knew what you were doing, was clear on what you were doing, and was like, hey, okay, I get it. I know you. I trust you. Let's go.
and work with us, and be open to start with, to say, look, we're still developing the technology, but we're going to provide you with very good therapists. We're passionate about it. This is what we're trying to do. Get them to believe in your vision and passion, and then they'll give you a break. In fact, that we're all human beings, right? So human beings like to interact with other human beings. So rather than just calling it networking, you can call it make new friends. Because if you make a friend with someone, then they're more likely to use you, or help you, and actually, the more networking you can do, with the more friends you can make, the easier life becomes, because all of a sudden all these opportunities start popping out everywhere. So that's what I would encourage everyone to do.
100%. And actually that leads on to one of the final points I really wanted to discuss. So obviously those who aren't in health tech, doctors in particular, who may want to start a company, or maybe held back from starting a company because they've got a great idea, but they can't even imagine seeing how anyone would think their idea is worth finding a solution for, or actually just getting started in itself. So what do you think, having gone through what you've gone through so far? I'm still sure that you are still at the very, very early stages of your journey, even though it has been 7 years. I certainly am. I can feel it. What are the commonly held misconceptions about actually getting started with a health tech company as a doctor? So take yourself back to when you had the idea of starting Dr. Julian, didn't even have the name, and thinking, I really want to solve this problem, I'm going to start a company, to actually what it actually is. What are the...
Interesting point. Okay, well, firstly, it is hard, but if you're passionate about something, you just need to go on and do it. And actually, will it make you happy? Yes. You then can have to ask people how to do things that know better than you. So that comes back to making friends and networking. How do you go and set up a company on Companies House? Okay, well, you can find that out by making friends with someone who's able to
that's the
cover
easiest
those
bit of setting up a company.
Yeah. Well,
that's literally the easiest bit.
Exactly. That's more of an admin thing. Okay. But as a doctor, right, misconceptions are, I think, especially when we did ours, like when I remember, I did find the clinical training program really inspiring, because it was a load of people that were together, that were clinicians, that were then given, made it allow us to do it. Because back then as well, it was like, you're a doctor, you're only a doctor, do not do anything else. That's really, really stupid idea. You've trained as a doctor, you need to be a doctor. But again, if you believe in something and you see it as a problem that you want to fix, you just have to get on and do it. And you are allowed to do it, by the way. You don't just have to be a doctor. If you want to do something else, you can go and do something else. And you need to do what makes you happy and what you're passionate about. And that's the key, the key to it. So, I mean, give me some examples of misconceptions and I can see whether I can address those.
A common misconception could be that you basically have to be an expert to start a particular company in a certain field?
Yeah, cool. Okay, so no one is an expert at everything. And the first thing to understand is what you can and can't do, and what you're good at. When you start a company at the beginning, right, you will just try and do everything, and you have to. And that's because you bootstrap it. And then you just have to muddle along and do the best you can. As soon as you can then, as I say, coming from networking and connecting with people that know more than you, then you need to utilize that knowledge and start to surround yourself with people that are good at the jobs that you are terrible at. And that is the key to growing a business. And I think for me, you go through a phase where you're doing everything to suddenly actually you can now delegate things, and wow, actually, and then that frees you up. And it's a hard thing because you're letting go of your baby, and it's actually a really difficult thing to let go of. But once you do it, and you start to grow, scale your company, you will see how much faster it can grow because you are giving jobs to people that are better than you at doing those jobs, and actually that frees you up to do the things that you're better at. So that you go through a transition phase of that.
I think that's a great illustration. I wanted to just take you back to, you've mentioned a few times now, you started off bootstrapping. So for those people that don't know what bootstrapping is, it's actually a terminology for basically funding your company with no other external investors. So that could be your own money, or money that you've earned from growing the company. So tell us a bit more about, why did you decide to bootstrap, and do you need a hell of a lot of money to actually start a health tech company? Because you only really hear about companies that are raising quadrillions.
Yeah.
Right. And then they're amazing, they've succeeded, they've raised a fuckload of money. Can you still succeed without raising money?
But do you know what I find fascinating about the ones that have raised so much money is, some of the, I'm looking at them, some of their burn rates, which means, by the way,
so much
how much
wastage.
they're losing, much they're losing each month. 10 million a month for some of them. That means they're going to run out of money. Quite, what are they spending? I literally don't understand. And guess what? Their revenue is like 1 million, and they're losing, and it's ridiculous. And they're raising this money based on a dream and a vision that actually then, so I don't know, some of them will be successful, of course.
Statistically,
but the majority of them will fail. So if you want to be safer, you build it up gradually with by staying close to market. So I guess with mine, the reason why I couldn't raise money is that I didn't know how to raise money at the time. I have no idea, because you start out as a doctor, trying to muddy your way through this. I would say there are you learn as you go, and again you use your network to help you, to teach you, to train you, to read up on things. And I think with mine, I did everything as cheaply as possible that was safe to do so. As I say, dodgy technology to start with, dodgy Russian app to start with, that then quickly didn't. I then found a much better developer to change that. But yeah. You don't go expensive at the beginning and waste money. You do things yourself to start with, as I say, but then when you grow, you can start to delegate that, fine. But you do as much as you can yourself, and you do go through this phase where there's a lot of pain, I'm afraid, when you do that. But it does mean that you are able to try and build something that you retain more of, which is helpful. I think maybe when you're a second time founder, you do things slightly differently, where you can go and raise loads of money. But yeah, a lot of the first time, from my perspective, I wasn't able to, so I had to raise it from family and friends to start with, and do things as cost effectively as possible, and build it up slowly. And that's why I said I was sort of faffing for 3 years, because I was iterating it in a much slower way that was with very few people in the company, and then once we got to an inflection point where actually, no, this is working, we're getting too much work now coming in, we need to now grow this. So that's when you can go and raise a bit more money from other people. But you've got to start somewhere, and you just got to keep going, and you've just got to sort of build it up as you go along.
Great. Well, thank you so much for your insights. And I guess my final question is, what advice would you give to doctors who are founding health tech companies as we speak, in general, like their approach and leveraging who they are, their background, being a doctor, in that approach to growing the company?
So my opinion is doctors are probably the best people to found health tech companies, knowing what you know as a doctor, you are going to be a stronger leader in that. And then you have to bring people around you to manage the other bits that you aren't good at, basically. But what I would say is, if you believe in something, you see a huge problem, and guess what, you know the problem better than anyone else if you're a doctor or a healthcare professional, and you see this problem and you're passionate about solving it, and it will get you out of bed in the morning, and you will be able to go through the painful days, then just do it, because that will make you happy. And you should just go and do it, basically, and it will be painful, and but I think the biggest thing here is resilience. You just got to keep going.
Oh, the last thing I was going to ask, actually, you have a child who is nearly 2, right? Congratulations.
Yes. Thank you.
Lifestyle and entrepreneurship, how do you marry the two?
Well, again, okay, so when you start, it's really hard, isn't it? And I think you just have to do what you can do. You have to try and time manage yourself effectively. You will be working continually. I found it easier with modern iPhones these days, because you can do so much work on your phone.
You can do so much work on your phone. I do as much work as I reasonably can whilst I'm on my phone, having 2 kids and those of 2. Like, you just have to adapt. But it is remarkable, right?
And do it. Yeah, no, you can. And I think we were talking earlier as well, is like, once you free yourself up a bit, the best way of coming up with ideas and being able to actually grow the company and move it forward is when you're not working. So when 100%. You're doing exercise, I mean, all my ideas come from when I'm swimming or running. Like, that's when you're most, I find that's where your brain works. But understand your brain and how it works, and adapt around it. But yeah,
completely echo that. Well, thank you so much, Dr. Julian Nesbitt, for joining us on this this podcast episode, which is also recorded. If anyone wants to get hold of you, what is the best way of doing that? Yeah,
sure. So, I'm on LinkedIn, Dr. Julian Nesbitt, or my email is julian@dr-julian.com.
Okay, brilliant. Thank you. And I'm sure we'll hear from you again in many different ways when you dominate the mental health market and beyond, I should say medical market and beyond.
Who knows? But no, thank you. It's really good to see you. Thanks again for having me.
You too. Take care.
All the best. Bye-bye.
I really hope you found this episode of value for your own career movements, especially if you are considering founding a health tech company, or you're currently running a health tech company. And for doctors who feel that they could really value from a lot of insights and expertise from myself and Medic Footprints and the team in getting started in their entrepreneurial journey, then please feel free to book a one-to-one call with myself or one of the doctors on the team, where we will evaluate where you're at in your journey and identify ways to help you move forward by using our personal and organizational networks. Because as we said in the interview, your network is your net worth, and this is how you uncover those opportunities, whether you're seeking them for your own career or whether you're seeking them for building your business. Alternatively, send me a message on LinkedIn or send my team an email at team@medicfootprints.org. I hope to catch up with you on the next episode.